Leishmaniasis is a parasitic disease. Its etiological agent, Leishmania, is a trypanosomatid protozoa. This protozoa can undergo either zoonotic or vertical transmission. It can also be spread through blood transfusions and contaminated needles. Leishmaniasis is endemic in the tropics, subtropics, and regions of southern Europe. Approximately 12 million people in these areas suffer from one of the 3 different types of leishmaniasis. It is one of the most common diseases among Iraq and Afghanistan soldiers. The vector of this parasitic disease is the female sandfly. It becomes infected with leishmania while taking blood meals from wild and domestic animal reservoir hosts, especially jackals and dogs. It then carries the harmful pathogen to its next victim, the human body. Let's move on to the mechanisms of virulence action. There are 2 basic body forms of leishmania called promastigotes and amastigotes. Promastigotes are the extracellular forms of leishmania in the sandfly, whereas amastigotes are the intracellular forms in the vertebrate host or the human body. The spread of this disease is a constant cycle. First, promastigotes are released into the skin through the sandfly bite. They then transform into amastigotes inside the human body, invade the macrophages, and replicate through binary fission. Amastigotes are finally taken up from the blood of the infected host when a new female sandfly bites. These amastigotes develop in the sandfly into promastigotes, and the cycle continues as it originally began. Time to get down to the nitty-gritty of leishmaniasis. There are 3 types of this disease: visceral, mucocutaneous, and cutaneous leishmaniasis. They all affect different parts of the body and therefore have different symptoms. And for those of you who aren't the best with looking at gory, graphic images, I suggest you cover your eyes for the next minute or 2. Visceral leishmaniasis, also called Kala-Azar, is the most severe form of this disease. It invades the liver, spleen, bone marrow, and lymph nodes. This causes flu-like symptoms such as fever, coughing, and vomiting, but the most prominent of these is the protrusion of the abdomen due to the swelling of the spleen and liver. Mucocutaneous leishmaniasis, nicknamed Espundia, invades the skin and mucous membranes. It causes the destruction of the nose, mouth, and throat, so soreness in these areas is prevalent a few weeks or months after the sandfly bite. Bloody noses and difficulty swallowing and breathing are 2 other major symptoms. The last of the 3 is cutaneous leishmaniasis, which is also referred to as Baghdad boil or tropical boil. These parasites invade exposed parts of the body, like the face, arms, and legs. Skin lesions are described as dry or moist and raised or ulcerated. There can be well over 100 lesions in severe cases. Soreness of glands surrounding these boils can also occur. Many tests can be administered in case someone is experiencing leishmaniasis symptoms. These include a biopsy of the spleen, liver, lymph nodes, and bone marrow, an indirect immunofluorescent antibody test, a complete blood count, a serum immunoglobulin levels test, and a Leishmania-specific PCR test. There is no vaccine against leishmaniasis yet, but attempts have been made in the past. There was a first-generation vaccine prepared in the 1940s in Iran using whole-killed Leishmania parasites combined with BCG, a vaccine to prevent childhood tuberculous meningitis. The combination of autoclaved L major promastigotes with and without BCG was tested in foreign countries like Iran and Sudan, but did not turn out to be effective. Professor Abulhassan Nadim of Iran gives his input regarding the importance of concocting a vaccine for leishmaniasis.
I became interested to work on leishmaniasis, cutaneous leishmaniasis, because even at that time everybody knew that this is a very important disease in Iran, and I myself and practically all members of my family in Tehran, we had the experience of cutaneous leishmaniasis.
Here's a list of medications used to treat leishmaniasis. The first 2 contain antimony, which is a heavy metal that is specialized in fighting off the pathogenic protozoa of the disease. The next 2 are antifungals that are especially helpful with the sores from the mucocutaneous and cutaneous types of leishmaniasis. Miltefosine is a phospholipid and an antiprotozoal. Like antimony, its specific job is to deteriorate the Leishmania protozoa. Paramomycin is an immunoglycoside antibiotic against the stomach parasites from visceral leishmaniasis. In order to protect yourself against the vector of leishmaniasis, the sandfly, you should wear long pants and long-sleeve shirts when outside from dusk to dawn. Screening windows is also helpful in keeping sandflies out of the home. Lastly, use insect repellent in bed nets as needed. 10 to 25% of DEET in insect repellents is the most adequate. Some cultural factors that come into play in regards to the spread of leishmaniasis are poverty, malnutrition, displacement, poor housing, deforestation, new irrigation schemes, and urbanization. I hope that this informational movie has educated you thoroughly on the severity of leishmaniasis and how it can be prevented. Thank you very much for watching.